So positive outcomes for client all around, a lot less anxiety, a lot less guilt and shame, and a lot more self-acceptance and increased report of relationship satisfaction.
And I'm wondering if you can give me like a case study example. Like, what does really good care for erotic minorities actually look like in practice?
Okay, so when we're talking about erotic minorities, I'll give you a good case example. So we'll say 36-year-old Indian cis-male, queer, in a relationship with his partner for 3 years. His partner is female, but he himself is queer, which is really important to this story. So this client in particular came into therapy because he was consuming incest and it was causing him some distress. There were also queer elements in the incest that he was consuming as well.
Yeah.
Family of origin was a bit chaotic. Each of the children, oldest sister was parentified. This client was the middle child and he was the peacekeeper. He was the one that was supposed to make sure that everybody got along. And then his youngest brother was the, in his words, screw up, we might say. Lots of inner turmoil between the children, trying to make sure that they were all taken care of. Parents had some addiction issues and some instability issues. I give that background just because there's some trauma elements in here. Client was mortified about what could happen if his girlfriend found out about the that he was consuming. And what he would do was engage in solo sexual behavior, consume, afterwards feel immense amounts of guilt and shame, which then would impact how he showed up with his partner. And she was very concerned because she could tell that something was going on. In a client like this, for a client like this, there's a couple different things that we want to do. The first is normalize the behavior. Client in this case was actually purchasing from ethical sites, which is usually something that we actually have to educate clients about. But he was already doing that. So we talked about ethical sourcing and made sure to give him credit for the fact that he was actually consuming it from an ethical source. We did also talk about the research. I actually pulled in Tell Me What You Want from Justin Lehmiller and talked about how taboo is one of the top fantasies, and so normalized it for this client. Normalizing it did help him reduce guilt and shame quite a bit here, but he still wanted to reduce his consumption of it. So it did help him have less beating himself up afterwards. However, we still looked at varying the types of explicit material that he consumed. So he did use some mental imagery. He did do some dirty texting with his girlfriend. He also started doing things like reading erotic novels. And so we tried to change it up for him so that he wasn't only relying on a single way of getting himself aroused. What we found with this was he was actually able to increase the type and variety of that he was consuming, the type and variety of explicit material. He also found that using his internal mental imagery made it so that a lot of what he was thinking about was much more in alignment with his overall sexuality. So what we found is it actually increased his comfort with his queerness. And he also got to share some of those themes with his girlfriend, and she was really accepting. And so what we found was the individual was able to achieve his goal of consuming less of the that was causing him upset, but he also reported better acceptance of himself. He also reported that his girlfriend was much more accepting of his erotic template than he initially thought she was going to be. So positive outcomes for client all around, a lot less anxiety, a lot less guilt and shame, and a lot more self-acceptance and increased report of relationship satisfaction.
Wow. What an incredible story. That's such a great example and just a good showcase of why it's so important to do this type of work.